Hi, my name is Dr. Bert Matheson. I'm a naturopathic doctor and registered dietitian and certified diabetes educator. And I work at New Hampshire Natural Health Clinic in Bedford, New Hampshire. And I just wanted to make this brief video to let you know about a therapy you might not have heard of before. It's called Low-Dose Allergy Immunotherapy, or LDA. So this is actually a therapy that was started by a British allergist back in the 60s and 70s, and there were published studies on this in allergy journals at the time. And then it was introduced in the United States by W.A. Schrader, MD, and he is a member of the environmental medicine group in the United States, and he has popularized this therapy in the US and studied it actually in 10,000 patients, most of whom improved with the therapy. So this therapy is similar in some ways to conventional allergy injections, although there are a lot of advantages actually to this therapy over conventional allergy injection techniques. And anyone who's ever had those therapies, I'm one person who's had conventional allergy injections, you'll know what I'm talking about when I say that that can be a very frequent treatment, at least initially, where you're getting it a couple times a week for several months, and then you start to spread it out once every couple weeks, once a month, but that takes some time, so it's pretty user intensive. So the advantage here with the LDA is that you only have to do it once every 8 weeks, which is phenomenal actually for those of us who have had the allergy injections done twice a week for several months. So people like that idea. The other advantage here is that it's a very, very low dose therapy, as the name suggests. So you have a very little risk involved there. So the side effect profile is very, very low. In fact, there's never ever been an anaphylactic reaction recorded in response to this therapy. So it's quite safe, and so that's another advantage. And then as you start to spread out this therapy, after you start to see benefits, usually some benefits can happen within the first 2 or 3 injections, and then people start to spread it out after they see a benefit. So you can spread maybe 1 injection every several months. Some people 1 injection a year, depending on the allergies that they have. So there's some real advantages to this type of therapy, and if you're paying out of pocket, it's an awful lot cheaper because you're doing it less frequently than conventional allergy treatments. So this type of therapy can really reduce your reliance on allergy medications, allergy supplements, and in conjunction with a good naturopathic allergy plan, this is just a phenomenal adjunctive treatment. So the other thing you might want to know about this treatment, certainly to be balanced here, there are some, it can be a little bit persnickety in the sense that, you know, it's a low dose treatment, so there are several things that can interfere with it. So there are various medications that can interfere with the treatment, and we do ask people to do a special diet just for 3 days, the day before, the day of, and the day after the injection. So that inhibits some people, but you know, for those of us who are willing to put the time and effort into maintaining our health, it's a small price to pay, honestly, for improving your allergic symptoms. So in summary here, this is a phenomenal treatment that's highly underutilized in this country. It ends up being cheaper than conventional allergy treatments if you're paying out of pocket, and it's less risky, and it just works well. It actually probably works better than conventional allergy injection treatments. So not a lot bad to say about LDA therapy. So I suggest anyone with allergies, and even somebody with multiple chemical sensitivity, you know, might want to try this treatment. There aren't many treatments for multiple chemical sensitivities, but this is one that has at least a 50% success rate, which is huge when you're talking about multiple chemical sensitivities. This also does work for food sensitivities and flat-out food allergies. So the mechanism of action here is different from conventional allergy treatments, which are IgG antibody mediated. This is hypothesized to be related to T regulator cells. So that's a different part of the immune system that we're talking about. So we think that that's how this works, is through the T regulatory cells, which kind of shut down overactive immune responses. And they last for quite a long time, the T regulatory cells. So doing this type of injection therapy can last for a long time. It can have an effect for a long time because of the survival time of these T regulatory cells. So that's wonderful, in the sense that you can spread these injections out. And for those of us who are needle phobic, this is a very, very tiny needle that just goes under the skin. It's almost the size of like an insulin needle, if you've ever seen one of those that diabetics might use. So it's not bad at all, actually. The injection feels like a little bug bite, that's about it. I know because I'm doing this therapy on myself. So anyway, if anyone wants to give it a go, our number, 603-623-6800. We're in New Hampshire. NHnatural.com is our website. So look us up. We'd love to help you out. Thanks. Bye-bye now.